Okay, a good morning again, and a happy Passover again. So this morning, I'd like to introduce Sarah Perloff, who is our speaker, kindly enough to take time off from, I'm sure, a very, very, very busy schedule. Just in case you didn't see it on my original email, Dr. Perloff is a board-certified infectious disease specialist who serves as associate chair of the Department of Medicine at Einstein Medical Center in Philadelphia. She is the director of their infectious disease program and is associate program director of internal medicine residency. And she is the daughter of one of our old-time members, one of our oldest members, probably, not in age necessarily, but in tenure, Mike Perloff. In any case, I'm going to try to figure out how we give Sarah the floor here. Let me see if I'm going to unmute you, Sarah. Let's see if I can do that.
I got it.
You got it?
Yep.
Okay. All right. Please, if you would, get started.
Absolutely. So thank you so much for inviting me. And I would like to take a little bit of time, just a short overview to make sure that we're all sort of talking about the same thing. And then I'd be happy to answer any questions that you may have. My one real disclosure is that I'm Mike's daughter. So I feel like you need to know that. I don't know why. Goals and objectives. I'm going to take a little bit of time to describe the virus and the disease that it causes. I'll really just identify some investigational therapy and explain effective prevention measures. But first, I kind of feel like we need to make sure that we all understand that there is a difference here. There are bacteria and there are viruses, and they are very different. Bacteria are clearly alive. They do reproduce on their own, regardless of whether they have something they're infecting at the same time or not. Viruses, on the other hand, there's a little bit of debate about whether they're actually alive. So I'm always somewhat amused when people talk about killing viruses because, well, I'm not sure they're alive to begin with. They need a living cell to reproduce, and they have no cellular machinery. So they have no metabolism, whereas, for instance, bacteria and bigger multi-celled organisms like us, we do. Antibiotics are usually effective against bacterial infections, whereas it's pretty uncommon to have a truly effective, treatable viral infection. And these are very different in terms of size. And so if you look at, this is sort of a typical type of bacteria, like this is actually E. coli, and compare it to viruses, these are some exceptions. These are giant viruses. Pretty much what we're dealing with, this is Zika here and parvovirus here. Coronavirus is sort of between the size of these two. So you can get a sense of the difference in kind of scale of what we're dealing with. Okay, so let's move on a moment to the virus itself. The virus itself is called SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome, Coronavirus number 2. You may remember SARS-CoV-1, that used to just be SARS from back in 2002. In China, it emerged, it caused a lot of panic, and then it just abruptly disappeared. Unfortunately, this SARS did not abruptly disappear and instead has been kind of spreading around the world, as you may have noticed. You may recognize that it is a member of the coronavirus family. Other coronavirus famous relatives include the common cold, SARS, of course, and MERS, which, if you haven't heard of, is the Middle Eastern Respiratory Syndrome virus. This whole family of viruses is found worldwide, though in temperate climates like ours, it tends to cause infections primarily in the winter. That said, in subtropical and tropical climates, infections can occur year-round, and it's not limited to a particular season, to the extent that they have seasons. We don't really fully understand that, and so it makes the predictability of our current virus a little bit more difficult, whether it's going to behave the way its relatives have, where wintertime is typically when you'll see it, and the remainder of the year it's either petering in, petering out, or not there at all. Remains to be seen. So we first identified this virus. It first emerged in Wuhan in the Hubei province in China. Initially, the cases were all linked to exposure to a wet market, which for anyone who's unfamiliar, it's where they sell and slaughter animals prior to sale for eating. However, this virus did what SARS, and this is very similar to the SARS-CoV-1, but what this virus did that SARS-CoV-1 and other viruses like avian flu and MERS did not, is it became very efficient at reproducing in human beings, such that it is now able to spread within the community with ease. SARS-CoV-2 spreads by something called droplet transmission, which means that the virus gets trapped in respiratory secretions, and when someone sneezes or coughs, well, this is what happens. It aerosolizes, it goes all over the place. It gets to spread to the next victim. So even small droplets are relatively heavy, and they only travel about up to 6 feet. Heavier droplets up to 3 feet. And I had an asterisk over here next to droplet transmission, because this coronavirus appears to be behaving somewhat differently than many of its relatives. And it may have the potential to be captured in even finer particles described as aerosol, which, just like an aerosol hairspray, is a fine mist. Those particles are so light that they're able to travel a lot farther, and they're able to stay suspended in the air for a longer period of time. It's thought that for the most part, coronavirus is spread by small droplet, which means it can go up to 6 feet, with the potential for aerosolization with really vigorous coughing and certain medical procedures. The average time to symptom onset is 4 to 5 days, though it's been reported to be as long as 14 days and as short as 2 days. Typical symptoms include fever, dry cough, fatigue, shortness of breath, body aches, and appetite loss. Less commonly, though recognized as very distinct here, is the loss of sense of smell and or taste in the absence of really nasal congestion or sinus congestion. Nausea, vomiting, and diarrhea can also be seen with or without respiratory symptoms. We're still sort of working out who gets which symptoms predominantly, but it does seem like people who are immunocompromised, like transplant patients, may be more likely to present with some of the GI symptoms before developing a respiratory illness. Okay, so this disease, as everyone has heard, I'm sure you've heard all about the horrible end of disease, the critical end of disease, but it's important to remember that really you don't hear about the less critical end of disease. 80% of cases reported in China and Italy are mild, and they recover within 2 weeks. Many don't require any form of hospitalization, and they recover without any significant sequelae. Severe or critical disease typically is hospitalized. They account for the remaining 20% of cases, and recovery time is anywhere from 3 to 6 weeks, with the caveat that we're presuming recovery. There is I don't have the published mortality rate at this point for the US, so I'm not gonna wing it. Factors that are associated with severe or critical disease include cardiovascular disease, diabetes, hypertension or high blood pressure, chronic lung disease like emphysema, COPD, and asthma, cancer, whether or not you're on therapy, chronic kidney disease, so impaired kidney functioning, older age, specifically, sorry guys, over the age of 60 is older age. And the CDC has also included other things like immunocompromising conditions. So if you're on prednisone or steroids more than 20 milligrams a day for more than a month, that would count as immunocompromising, HIV infection, and a variety of other drugs that are used to treat even things like transplant drugs and rheumatologic drugs may be included in that. Severe obesity with a body mass index over 40 is included in the CDC's definition. And I would have to say that based off of our hospital's experience, that seems very accurate as a risk factor for severe disease. Although specific data with regard to the CDC's definitions has yet to be released, so I can't answer about where we are there. Treatment, it's important to remember there is no identified proven treatment here, regardless of what runs around on the internet. Any treatment that is given at this point is experimental. There is no data to support it. So as a result, if you have mild disease and you don't require hospitalization, the recommendation is really not to treat that, because there are risks associated with any experimental treatment, including the hydroxychloroquine that has been all the rave on the news, and can throw you into, for instance, a heart arrhythmia that will kill you. And so for mild disease, that risk hardly seems worth any potential unproven benefit. So we do not recommend it. In the event that you are hospitalized with moderate or worse illness, remember, only experimental therapy is available. That said, once you've hit the point of requiring hospitalization, the risk-benefit ratio changes. And the benefit now seems a little bit more potential, or rather the risks seem less of a risk in comparison to potential outcomes with the possibility of benefit. It is really recommended that any experimental therapy be done as part of a clinical trial. And for the most part, that is what's done. However, when you're not able to do that, there are ways to ask for emergency permission to be able to use experimental therapies. I'll tell you, for instance, at the moment, we're in the process of setting up a study for one of the antiviral drugs. And it is a solid 2 weeks now that we've been working on just getting it up and running, hoping to have it going this week. So, you know, it's not a fast process, and it is a very stringent process to try and ensure the safety of the patients being treated who are included in the study. So what are some of these potential treatments? I'm sure you've all heard about hydroxychloroquine at this point. And there was originally a lot of hullabaloo about adding hydroxychloroquine and azithromycin. I'm pretty sure that was out on the news, although I have to be honest, I haven't been keeping up with the news as well as I might. I'll tell you that most of the infectious disease community has ditched the azithromycin. That particular combination has led to a very high rate of arrhythmias that lead to death, and we're not using it. The data that did come out on that combination was small in number and quite frankly had a lot of methodologic problems coming from an investigator who has a history of, let's just say, isn't exactly moral. Some of the other, and whoever just logged in, please. Thank you. Some of the other investigational therapies include remdesivir, favipiravir, I can't really say that. Remdesivir is completely investigational. Favipiravir is an influenza drug in Europe that we're starting to investigate in the US, though I don't believe it's being investigated anywhere locally. The use of convalescent plasma, which really means that we take blood from people who have had COVID and recovered. And we sift through it and kind of glean out their antibodies, and we give those antibodies to people who are acutely ill. And that, I'll tell you, is also a trial we're working on at Einstein, for what it's worth, getting that set up and going. You may have heard about a number of other investigational agents. Most of the other therapies, like tocilizumab, are really not antiviral therapies. They are therapy intended to treat the inflammatory process that's making you sick. So as a basic primer for infectious disease and immunology, I'll tell you that most of the symptoms that you get they're not a direct result of having the virus or a bacteria at a particular site. It's your body's immune system telling you you're sick. It's its response. So fever is its response. Inflammation is a general response. And so our goal is to try and head off some of the excessive inflammation that, while needed to kill the organism, goes a little overboard and makes you extra sick and damages your lungs in the process and potentially other organs. So for prevention, I'm sure you've all heard it, but wash your hands. The most important thing you can do is wash your hands, frequent hand hygiene, whether that's with hand sanitizer or water and soap. Avoid touching your face. And during this time of broad community spread, social distancing, it sucks. I am in the midst of it. I'm at about 4 or 5 weeks of it, and I've had it. And I've barely left the house. It is really hard to do, but it is one of the most important things we can do to decrease the ability for this virus to spread within our communities and overwhelm hospitals. In the event that you do have a cough or a sneeze, be polite about it. Obviously, cover your mouth. Sneeze or cough into the crook of your elbow. And then the CDC this week announced that when you're out in public places where you're basically around people, you should be covering your face. They recommend masks made of cloth, not surgical masks, and not N95s or construction level protection. Simply covering your face. There are some great no-sew demonstrations for how to create a mask out of a bandana and 2 rubber bands on YouTube if you're interested. And then lastly, clean high-touch surfaces often. Things like doorknobs, the steering wheel in your car, anything that you go to often. Knobs on the ovens and things, the fridge handle. Clean them frequently. If you want to know what works against coronavirus, you can go to this website from the EPA, which tells you, which products specifically are effective and how long you have to let it sit there before it is effective. And lastly, vaccination. In truth, most viral infections are most effectively presented by being vaccinated. And so we don't have a vaccine. I hope to have a vaccine. We're working on a vaccine, but for the moment there isn't one. I would not anticipate a vaccine to be available for probably upwards of 1.5 to 2 years at the earliest. So in the meantime, we have to really work on our other measures. And that is me with one of my coworkers. We are getting our N95 fit testing to make sure that we are, in the right sized mask at work. And we look silly. And so that's why I included it. And that is all I have. So thank you very much. And I'd be happy to take any questions you might have.
So Sarah,
Thank you.
Sarah, I think there were a bunch of questions that hopefully were transmitted to you. Do you want to go through those?
Sure.
And then we'll open up the floor and see if there's some from the floor.
Sure.
Okay, let's go ahead.
All right, so the first question was, is a person still contagious after recovering? And if so, do they still have to wear masks when near other people? That is a great question. At the moment, we think that by the time you have been afebrile for 3 days, and so long as you have been at least 1 week since symptom onset, you are probably not contagious anymore. And so at that point, you wouldn't have to wear masks anymore, so long as you're not still coughing a ton. If you're still coughing a lot, we would recommend continuing to wear a mask. There is some data emerging about being contagious. I'm going to kind of make a leap here, being contagious prior to becoming symptomatic. And so similar to the flu, people who have SARS-CoV-2 infection or the syndrome COVID-19 have the potential to spread disease before they know they're sick. So just like the flu, you know, that's partly why social distancing is so important, is that you may be able to spread it. Oh, can you not hear me? Or is that just my dad?
No, I can hear you. Raise your hand if you can hear Sarah. I hope everybody can. It looks like they can.
Yeah, Dad, you just need to turn up your hearing aid or something.
That's a good one, Sarah.
Thank you, thank you.
So let me just say something for a minute. Why don't we let Sarah go through the questions that were sent in? And if you have another question relating to her answer, make a note of it, and we'll call on everybody as long as Sarah has time. We'll call on everybody when she finishes the questions that were sent in. Go ahead, Sarah.
Okay. All right. How many times can the same mask and gloves be used? So the same mask can be used repeatedly, so long as it is not visibly soiled or, you know, contaminated because somebody just coughed in your face. The concern, though, is that you really want to make sure that when you take off your mask, you're taking off the mask in such a way that you're not touching the outside of the mask. The outside of the mask is what will be considered contagious or potentially infective. And so when you take the mask off, you want to take it off from the inside and unloop it out around your fingers. If you're using a cloth mask, which is really what's recommended, you should really only use that once. And then it should go in the wash and be laundered right after. Gloves are not recommended to be used more than once. Alrighty. To help build our immune defense against any possible COVID exposure, do you recommend that we take any specific supplements or vitamins? No. A flu typically diminishes and goes away when the temperatures go up, but states like Florida, with a relatively higher temperature than we do, still had many COVID-19 patients. Is this virus not affected by warmer temperatures? So as I've said in the talk, this virus is now seen pretty much worldwide, irrespective of the climate. So we don't know whether it's going to go away in the winter, and we have yet to see kind of what's going to happen with season change. So we'll all learn about that together. I've heard many different numbers when it comes to how long COVID-19 remains active and dangerous on various surfaces. How can I best protect myself and my family when handling groceries and the mail? Great question. So when handling groceries, I generally recommend that you wipe down any surfaces that are able to be wiped down. So for instance, when I get my gallon of milk, I put it in the sink and I wash it off with just soap and water, dish soap and water. In the event that it's paper packaging, generally paper only kind of allows the virus to stick on it for about 24 hours. So this goes for mail as well. If you bring in the mail, put it down, wash your hands, and let it sit for a day, you should be fine. As far as groceries and food itself, food has not been implicated as a mode for transmission. So I will have to leave it at that. Does a 20-second soap and water hand washing kill the virus or simply facilitate it, getting it off your hands? A little of both. Quarantine questions. How long do I think the quarantine should last? That depends on what we're talking about. Are we talking about quarantine when you have symptoms, or are you talking about the social distancing where we're recommending people stay at home? As far as the social distancing and staying at home, that's pretty hard to say. Oh, okay. I just lost my screen. Okay. That's kind of hard to say because it depends on, what's going on in the community. So as we see numbers, I anticipate this region will probably peak in the next week or two. And hopefully after that, we'll be able to get somewhere back towards thinking about normal. Is it likely that this disease will flare up again in the fall? I'm going to go with probably. Again, it's all speculation, and that's my best guess. Will we be quarantined again? I don't know. Sorry. Diagnosis questions. If a person is hospitalized with COVID-19 and dies of pneumonia or cardiac arrest, is that person officially counted as a COVID-19 fatality? Yes, they are counted as a COVID-19 fatality, regardless of whether it's listed on the death certificate, because their positive testing is reported to the Department of Health, and they link them together. So it is counted as a COVID-19 fatality. Assuming a vaccine can be developed, how long does it take for a virus to mutate? Well, it's very variable depending on the virus. This one appears to have a conserved region in its spike protein that makes it a good candidate for a vaccine to have prolonged efficacy. Is it possible for a virus to mutate and become less deadly? Not usually, but sure, it's possible. Just not common. And then lastly, it's allergy season for many of us. Oh, that's not lastly. It's the last one in this category. It's allergy season for many of us. How do we tell the difference between having COVID-19 and an allergy? So allergies typically will have, sneezing, watery eyes, runny nose or stuffy nose, sinus congestion, and no fever. And COVID-19 should not have, as a general rule, runny nose, sinus congestion, and will have fever. So those are some of the bigger differences. COVID-19 is much more likely to have fever than anything else as a presenting symptom. So, we look at fevers as being a very good way of kind of identifying early presentation of disease. Treatment. Regarding living wills, I have requested that ventilators not be used in general. Should I modify my living will to make an exception if I am ill with COVID-19? Put another way, how many people survive because they were on a ventilator? So that answer is highly variable depending upon your age. In general, if you are on a ventilator because of COVID-19, I would maintain your living will as is. I'm sorry, let me rephrase that. If you are on a ventilator, I would probably tend towards advising using the do not resuscitate clause in your living will. If you are being offered a ventilator, it may be prudent to say, well, depending on your comorbidities, say you have no other comorbidities, comorbidity being other medical conditions, yeah, let me give it a shot for a few days. But to be perfectly honest, people who get on ventilators do not do well, especially the older that we get. And I think the last two questions I've already answered, so I can move on to the audience.
So what I'd like to do, if we can, is I have you, excuse me, I have you all muted. If you raise your hand, I will know that you have a question and I will call on you. Be patient if I don't get to you right away. I have a feeling we're going to have a few questions, but just be patient, one question at a time, and that'll give everybody a chance. So Eli, I think I will unmute you and you can ask the first question. Hold on. All right, you're unmuted, Eli.
Thank you. My question is, I hear that some people get re-sick again. Can it be? As I mentioned it in South Korea.
Meaning reinfected?
Yeah.
Possibly. We don't have a full understanding of whether having it gives you immunity to having it again. And so possibly. They've also reported out of South Korea a syndrome of reactivation. So no, it's not reinfection, but it's their same virus kind of flaring back up. And so, that's an unanswered question at this point.
And I have one more question. I had radiation for prostate cancer, and I was done around August. I'm still vulnerable?
I'm sorry, you said you had what?
Radiation.
Radiation? In August?
I'm ended in August. last year.
Probably not.
Okay, thank you.
Okay, Alan Haber, I'm going to unmute you. Go ahead.
Okay. Just a quick question, Dr. Perloff. I just read something as early as this morning. There's another experimental treatment, hydroxychloroquine with doxycycline. There were, I think, 3 infectious disease specialists in Long Island used it on, I think, 47 patients in Long Island long-term care. They got pretty favorable results. So I guess my question is, since we're about 12 to 18 months away from a vaccine, the method of treatment that probably infectious disease specialists are probably going to use, would you estimate it's going to be a one-on-one? What's going to work for that particular patient based upon that particular patient's clinical condition?
No. I think at this point we're really all trying to pool data and come up with what works for
the majority.
Statistically, what's going to work for the majority.
Okay. Thank you.
Mm-hmm.
Okay, Gary Sternberg, I'm going to unmute you. We can't hear you. If you can hear me, I unmuted you. You're unmuted, but your speaker.
Okay, hi, can you hear me now?
There you go, okay.
Yeah, hi, Sarah. 2 quick questions. First of all, you mentioned people should wear cloth masks instead of the N95 mask. Is that because they're better or just because you want to have the healthcare professionals be using the better N95 masks?
It's because the N95 is really needed for aerosol generating procedures. And for the most part, the purpose of the mask is to prevent your droplets from escaping out into the world, less so than to prevent other people's germs from getting through. It's been shown to be pretty effective at doing that. And if everyone's wearing their mask, you should be in good shape. The N95 should be reserved for healthcare workers who are like forced to be, 3 feet or less, actually, even less than that, who are stuck in a room with a patient who is having an aerosol generating procedure. So, every time someone needs to be intubated, we need an N95. Anytime they're requiring a nebulizer treatment, we need an N95. And so for the most part, it's because of the likelihood of needing an N95 in public is so low that it's not deemed to be an effective use of resources.
Okay, and the other question is, if someone is pregnant, is it possible that the fetus can be impacted by the virus?
Still working on that data. I don't have good information on that, I'm sorry.
Okay, thank you very much for your excellent presentation.
Thank you.
Thank you. Ed Melman, I'm going to unmute you. Go ahead.
Thank you. Thank you, Sarah, for coming today. A couple questions about masks. For people who are jogging outside, are masks really necessary in that situation if you're not going to be in contact with anybody other than family members? I think that masks right now are being vastly overused because people are using them in circumstances where they're inside the house and they're just with people that they're socially isolated with, and there should be no real risk of contamination if that's the case. And the risks in an open air situation where you're not within 6 feet of other people, the masks do interfere with your breathing.
Yes, they do. And so you have a good point. If you're only around the same people that you live with and you're already kind of sharing your aerosolized spit with, what's the difference? Interestingly, I read an article just the other day on the slipstream, the amount of aerosol in slipstream. So the slipstream is what's behind you when you're running.
I read that article also.
Yeah, it's, you may want to stay out of that particular area when you're running, but if you're running by yourself, I don't think it's an issue.
Yeah. The other thing is that Sarah Long had indicated that for people taking Plaquenil that you were recommending EKGs because of the arrhythmias. To the best of my knowledge, my rheumatology colleagues don't routinely order EKGs for Plaquenil. On any of the protocols using cardiosensitive drugs, are you recommending EKGs for those patients?
Yes. We are using higher doses than are typically used in rheumatologic disorders. And so we have been doing a baseline EKG and then daily EKGs thereafter.
Okay. And
Thank you, Sarah. Bert Schaefer, I'm going to unmute you.
Okay, what are your thoughts about testing the public before we relax all these things and letting people go back to work and so forth? You think it's valuable and it's practical?
I don't think it's practical. If we had all of the resources in the world and we had no problem with regards to the amount of supplies to perform all of those tests, there might be something to it. But I think for the most part, it's not a practical thing to try and do. I get similar questions about why don't we test every healthcare worker, once a week? And again, it's just not practical. We're already struggling to keep up with the testing of the people who are sick, much less the people who aren't sick. And so long as everyone is following the protocols for, personal protective equipment, they shouldn't be able to effectively spread disease, even if they are asymptomatic and have been infected.
Thank you.
You're welcome.
Thank you, Sarah. Barney Kaplan, I'm going to unmute you.
All right, thank you. It's good to see everybody. It's good to see that almost everybody's fully dressed, actually. So Sarah, my question is, I'd like to know what's going on in your institution. What's your census running? What percentage of the patients are COVID-19 patients? What percent are in the ICU? What percent are being ventilated?
Yeah. So our hospital as a whole has not reached full capacity yet. But I think also the people are largely staying away. It also helps that we have no elective surgical procedures that are happening at the moment. So we have a little bit of extra bed capacity. That said, our ICUs are bursting. We have expanded into 2 additional ICU areas, and we have plans for converting our step-down unit into an ICU next. We have medical ICU level patients who are being cared for by surgical intensivists and cardiac care intensivists. The number of patients kind of on average in the hospital with COVID-19 diagnosed by a test at our institution has been running in the hundreds. We have the medical intensive care unit has 26 beds, and almost all of them are COVID. So yeah, it's been challenging.
What percent are being ventilated at this point?
Everyone in the unit is ventilated.
Thank you, Sarah. Anybody else, if you raise your hand and keep it up for a few seconds, I get a signal that you want to ask a question. Alan Finkelstein, I'm going to unmute you. Go ahead.
All right.
Go ahead.
Can you hear me?
Yep.
Yes.
Okay. Well, first thing is I have 2 N95 masks, but that's because I bought them 6 years ago to do painting in the basement, where they said if you don't have adequate ventilation, you should wear this particular mask. I had to wear it yesterday to go in the Home Depot because I don't have cloth masks. Can an N95 be reused? And if so, what do I have to do to sanitize it?
It can be reused, but there's not a way for you to re-sanitize it. The methods that I'm aware of are not readily available in a person's home. There's stuff on the internet about, stick it in your oven. Please don't stick it in your oven. It will not a good idea. But I'm going to go with no. Let's not reuse N95s.
Okay.
Sarah, when you say let's not reuse them, if you have one and have used it before, is there anything wrong with sticking it back on your face?
So if you've used it before, for what?
Let's say he said he used it for painting 6 years ago.
Yeah, that's not a problem.
I was going to say, it doesn't seem like there would be any germs lingering from 6 years ago.
Probably not. Depends on the germ, though. Some of them are hardy.
Okay, I'm going to
Ed,
unmute.
Ed, I haven't asked my second question.
Go ahead.
Okay, the other one, Sarah, is a number of South Jersey members were supposed to go to Europe for a tour, and it got canceled and rescheduled 1 year from now. What is the likelihood that this virus is still going to be around and that we're going to be advised not to travel in a year?
I have no idea. Sorry.
Thank you, Sarah. Ed Silver, I see you waving at me. I'm going to unmute you. Welcome.
Thank you. I didn't know I had a camera.
We see your teeth and your chin.
Yeah. Dr. Perloff, thanks for taking your time to join us. I don't know if it's placebo, but during cold season, if I'm exposed to people who have colds, I've taken prophylactic zinc lozenges and echinacea, and I'm wondering if that might be useful to prevent symptoms.
I have no idea. There's not any real data on that, so I can't answer.
Thank you.
Thank you. I'm going to skip through. If you wave at me if I don't see you. Myron Miller, I'm going to unmute you.
Thank you, Doctor. Thank you very much. I just have a quick comment. My wife's grandfather just graduated from medical school in 1918 and was thrown into the fighting of the pandemic at that time. And we have a letter from him to his family about what went on. That's it.
Cool.
Thank you. Anybody else wave at me so I can see you? Dick Nemiroff, I'm going to unmute you. Go ahead.
And thank you, Doctor, for an excellent presentation. I'm a physician too, and I'd like to ask you about two supplements that I have done some work with. One is large doses of vitamin C as an antiviral agent. Linus Pauling first proposed this, 4 grams a day. And the second supplement is vitamin D3, which we know is also shown to improve your immune status. And I was wondering what your thought is on those two easily obtainable supplements at that dosage.
Yeah, I think vitamin C, you take enough of it, you pee a lot of it out. As for the D3, I don't know. You know, I think you're better off with a balanced diet than spending a lot of money on extra supplements, to be honest.
Well, they're not very expensive. My second question is in Israel, they are using immature T cells as, and they're generated from placenta. I've done some work with that at Children's Hospital. And they're having favorable results, but they've only tested 7 very critically ill patients, and they're going to expand that to 100 during this week. What are your thoughts on that as a possibility? Have you heard of this?
I have not read about it, so I really don't have any thoughts about it.
Okay. Well, the presentation is very provocative, and I really enjoyed your coming here. I wish we could share our bounty, but we'll have to have lox and bagels at home.
Another time. Well, not this week, but.
Yes.
Thank you, Dick. Anybody else? Let's see if we can get a few more in. I don't see anybody. I do see somebody waving down here. Dave Wynn, I believe.
Yes.
Go ahead, David.
Sarah, thank you very much for your presentation. I have a couple of questions. One is a macro one. Trump wants to open up the country on May 1st. What do you think is the earliest date that you think it's safe to open up the country? And second of all, you indicated that when you get mail, you drop it off. I also get newspapers. What should I do with that? How soon after they come in the house can I use them? And I assume I have to wash my hands after I touch them.
I'm going to start with the newspapers. So with the newspapers, obviously you kind of want to read them that day, which is fine. Read them. Try not to touch your face while you're reading them. And then wash your hands after.
Yeah.
For the mail, it's 24 hours from the time that it was potentially inoculated. So I would say the mailman was the last person to potentially inoculate. And that's the 24-hour start time, is when the last time the mailman touched it. The first question about when is it safe to reopen the country, I don't think we can really say that at this point. We don't know. We simply don't know what, it depends on the state of community spread, and as it's going across the country, we're not even all in sync at this point. So I don't think it's even fair to give a timeline, because it's not realistic. The timeline is based on the virus, not on our calendar.
Thank you, Sarah. Mm-hmm. Anybody else? I'm looking for hands. Phil Gutteroff, I see yours. You're unmuted.
Great. Thank you so much, Doctor. Should delivered food, like already prepared restaurant food, be reheated? And if so, what temperature and for how long?
No, you don't need to worry about reheating the food.
Doctor, I'm going to expand on that one. How do you feel about delivered food and dealing with it?
I'm okay with it, actually. I've personally had some food delivered, whether it's the groceries or actual cooked food delivery. I think most of the people who have done the deliveries, they've had their masks on. I see them washing their hands right after, with the hand sanitizer right after they deliver whatever it is they're delivering. I think they're going to, they're putting forth their best foot in terms of trying to limit themselves as a potential vector of disease. And quite frankly, it's a good way to help prevent us from congregating elsewhere, trying to get the things we need. So I think it's a reasonable process.
I'm wondering, I can understand your feelings about the person delivering the food. I'm wondering about the unseen person preparing the food.
Yeah, so I did actually do a quick double check before, or as I was preparing this talk. The FDA says there has been no reports of foodborne illness with COVID. And I was unable to find anything in the literature to suggest that that was a modality for transfer of infection.
Thank you. I'm looking for hands. Anyone? Judy Klee or? Doesn't look like Judy, but
I know. I'm here. Hello.
Hello, Judy.
So,
go ahead.
Hi, it's for Larry. Yeah, he's your member. So we're staying home pretty much all the time, as everybody else. And if we're not going out or having people in or having groceries in that day or two, how much surface cleaning do I have to be doing? Wiping down surfaces and doorknobs and the refrigerator door, if nobody's here for 2, 3, 4 days at a time, except Larry and me.
Yeah, I wouldn't worry about it as much.
Okay.
I would just do your regular cleaning schedule, whatever that happens to be.
Okay. Thank you.
You're welcome.
Great presentation. Thank you.
Thank you.
I see Eli, but I'm going to look around. Eli, since you've already talked once, let me see if there's someone who hasn't spoken. Anybody else? I'm looking for hands. Marty Raffner's coming on the scene. Go ahead, Marty.
Just out of curiosity, when you go through the supermarket or produce place and you pick up vegetables, which obviously anybody can touch, and you bring it home, will the high temperature of cooking destroy the potential virus?
Yes. Anything that you bring home that you're planning on eating raw, I would recommend cleaning off again with dish soap and water. Even things like an orange that you have to peel, you want to wash the outside of, because you can contaminate the inside in the process of doing the peeling.
Thank you.
Larry Bernstein, you're unmuted.
Yes, good morning. So I had to follow on to the questions that were asked about food. Any extra precautions you think need to be taken where you're ordering food and then going out and picking it up, where you've given them the credit card over the phone and they leave the food in a box or a bag just outside the restaurant? Anything extra you need to do, or do you feel that's a pretty safe way to bring food home?
I think that's pretty safe. Anyone who has, high risk for severe disease and concerns about potential for transmission of infection, again, I would take anything out of the bag or box or however it's delivered, and wash your hands. That's about it. Hand
Good,
washing is kind of big, but yeah.
Thank you, Sarah. Sarah, are you up for a few more?
Sure.
Okay. Looks like Rabbi Aaron.
Yes. I have a question about preparing food that you're going to eat raw. How long would you say wash the orange, wash the apple, or something like that? And what about something that you would not want to put soap on just because it will be affecting the taste, like a peach?
It's not like you're still washing it off. You're not going to leave the soap in place. And 20 seconds should be effective.
Okay, just like your hands.
It's like your hands. And again, I want to reemphasize, there's no evidence that this infection has been spread from food.
Even from contact with food.
Mm-hmm.
Okay.
Eli, I'm going to unmute you again.
Yeah, he asked the same question that I wanted to ask. My daughter brings her food home and she washes everything, the avocado, the carrot, with soap and water. I said, crazy.
I'm going to ask Sarah, I'm going to expand on that one. I thought I had read where they were saying, don't use these antibacterials or soap on things that you're going to eat, that it might be worse. Well, I don't know if it could be any worse, but go ahead.
I'm not sure what you mean.
Well, I think they were saying, when it comes to vegetables and so forth, they were not recommending that you use soap on them or cleaning agents or whatever.
I haven't heard that one.
Okay. All right. Anyone else? I don't see any here. No, I do. Todd Weisenstein, please. Go ahead. You've got, I'm going to unmute you again. For some reason, it's not letting me unmute you. I don't know what, no. Here you go. There you go.
Okay, great, thanks.
You're good.
Good morning. So thanks for doing this. When talking about reopening the country, what are your feelings about the education system when it comes to the public schools and the universities? Everything's shut down. What are your thoughts?
I think that, again, it's similar to opening the country. It really depends on what's going on with the virus in the community, at the community level. And the problem with things like universities is that people are coming from all over and can be coming from one area of more extensive transmission than where the university is. So that's a little bit of a different ball of wax than a public school system where children are, all from the same community. That said, I think it's likely that schools are going to stay out for the remainder of the year. By year, I mean academic year, so through June. After that, who knows?
Thank you, Sarah. Sarah, I'm wondering about the wearing of masks and how long we might be into that. We're obviously talking about there's not going to be any inoculation available for 12 to 18 months. It seems to me like we might be wearing masks for a year. You have any thoughts about that?
Yeah, so the use of masks is really going to be more dictated by the level of virus present in the community. And we can already say that, we can see that it does, as the community develops a degree of herd immunity by virtue of people being infected, we see less and less of it transmitting through the community. And at that point, we'll be able to say, ditch the masks. I don't think we're going to be wearing masks for 12 to 18 months.
Don Weisenstein? I'm having trouble unmuting. No, I don't, there you go, there you go.
Oh, great. Sarah, how many children are being treated for this? Is there any statistics on that?
I'm going to be honest, I'm an adult infectious disease doc, so I don't keep track of that. I know that in the China data, it seemed that children really, if they got infected, they didn't get very severely infected. But there have since been reports of, children with very severe disease. I just don't know the numbers, I'm sorry.
Mike Perloff, it's taking me a second to unmute people. There you go.
Hey, did my little girl do good or did my little girl do good?
You can fell on that.
Is that the question for me?
Oh dear.
Oh.
The question is this: Could you tell us how this pandemic has impacted on the doctors and nurses and your work life? The number of hours, what you have to do.
Yeah, it's been rough. There's a lot of anxiety in the healthcare field. I give major props to the nurses, the respiratory therapists, the residents who really have no choice but to be first line and be present in front of the sick patients to take care of them. My days have gone to being on average 14 to 15 hours of work. My division is working 100% from home through telemedicine because we have been told that basically we don't need to see the patient in order to make a lot of our decisions, which is probably true to a large degree. It's been done in an effort to preserve personal protective equipment. Our hospital does not have enough gowns or masks. Everyone they're issued a mask to keep for a week or more. And the surgical mask, they have to keep it in a paper bag and follow very strict procedures to keep it from infecting them. The N95s they're using only in certain procedures, and that's a one-time use. The gowns, we are actually at critical shortage at this point and are asking people to do their best to not go near a patient. And then we have rooms that are being designated, the room is being given a gown and people have to limit how many people use them. They have to be wiped down with, cleaner after they've been used and then re-hung up. It's not ideal. It's been exceptionally stressful. Yeah, it's been rough. It's been really rough.
Thank you again for the very enlightening time this morning that you've spent with us. I'd like to read you a thank you written by Lewis Aaron. Dr. Perloff, thank you very much for your wonderful presentation. We all know how busy you are and how very thankful that you spent time with us. Our prayers and best wishes are with you and all your colleagues. As always, be safe, be healthy, be blessed. Thank you so much. If there's something specific that the club can help you with at Einstein, maybe you could let your dad know what that might be, and maybe as a club we can get together and help you out there.
That would be great. Thank you so much.
And normally we would give you a certificate of membership. So please accept this virtual certificate. We'll have a real one for you and pass it on to your dad. And come and join us for lox and breakfast. I think your dad said he would split the cost with you when you come. No, seriously, come and see us for breakfast whenever you have a chance. When this is all over, we'd love to see you and have you there in person.
Thank you so much for inviting me.
Drop hand.
Thank you. Sarah, if you want,
Thank you.
if you want to stay on, you're more than welcome. We're just going to do a little bit of business, not very long, and we'll let everybody get back to their little jobs at home or whatever they're doing.
All right. Well, thank you so much. I'm afraid I do have to go. I have my next conference call in a few minutes. So everyone stay safe.
Thank you very much.
Thanks, Sarah.
Thank you. If everybody will stay on, I'm going to unmute you all. I hope it's not too noisy. Let's see if we can do that. So you're all unmuted. I'm going to ask a couple people to say a few words. Can you please wave if you can hear me? I want to make sure that I'm being heard. Yes. Okay. Thank you. Mike Perloff, do you want to take a minute and tell us about law enforcement breakfast, please?
Yes, last week I spoke with the presidents of the Chiefs Associations for the 4 counties, plus all the sponsors. And even though we think it's possible that things will be better for the June 16th date, it was pointed out that because of the stress in law enforcement, that quite a few guys are going to use vacation days to decompress. So we decided, with everybody concurring, that we're going to skip this year, and the next one will be in 2021 sometime.
Thanks, Mike.
Good.
If anybody has some late news, as you all know, Dave Singer, I'm going to take a minute. I'm going to mute everybody because there's a lot of stray sound, and then I'll unmute. Okay, you're all muted, so I think you can hear me. Wave if you can hear me. I want to make sure you're hearing me. Yes, thank you. I'd like somebody to give us an update if they have it on Dave Singer. As you know, he was admitted to the hospital, I believe, with the COVID. I haven't heard anything in the last few days. Does anybody have any late news? If you do, could you wave your hand and I'll recognize you? Keep waving. I don't see anybody. David Nydorf, yes. You're unmuted, David.
I spoke to Elaine yesterday. She is telling me the news is not looking too good. He's been on the ventilator for about 13 days, and they're not giving her such good optimistic comments, to tell you the truth.
I'm sorry to hear that. Let's all take a minute and just think about Dave, and maybe we can send him some good vibes or a good prayer, and hope that he recovers. Thank you, David. Let's see. We have. I'm going to call on Rich Moskowitz if I can find him in this array and ask him to tell us the latest on Yom HaShoah. Hang on one second. There you are. Thank you, Rich. You are unmuted, I believe.
Yeah, okay. First, a little bit of good news, sort of. My son, who's working, he's a physician, he's working in Brooklyn at Mount Sinai, which is a hotspot, of course. And the last 3-4 days, they've seen a marked decrease in the number of ER patients as before. So hopefully the peak has come and we're starting to flatten out a little bit. So that's maybe, hopefully good news, and it'll keep going. As for Yom HaShoah, there'll be a virtual Yom HaShoah meeting. I'll send you or Randy the link, and then we can send it out. It'll be online and with some remote speeches and things of that sort. Because it's important, because it was the 75th anniversary of the liberation of Auschwitz. So I'll be sending that link to it, but it'll be virtual.
I believe the JCC has a 500 version, 500 participant version of Zoom, and I assume that's probably what they will be.
That's what they'll be sending out.
So that'd be
Yeah.
great.
Okay.
Thank you, Rich.
You're welcome.
Anyone else? I'm looking for raised hands if there are any. I see someone here, Ed Silver. Go ahead, Ed. I think you're
Okay.
unmuted. I don't hear you.
Ed,
Here you go.
Ed, as a former president, knowing how much it takes to organize things, I want to thank you for all you've done during this pandemic to keep the men involved. I think you've done a great job, and I want to thank you.
Thank you. Thank you. Anyone else?
David Schwartz.
I just cursored through somebody. Let me see who that was. Don Weisenstein.
I don't want you to forget to do the 50-50.
Yeah. I'm the winner. I declare myself the winner. Anyone else? I'm looking for raised hands.
Can you hear me?
Mike, who's somebody? I hear somebody. Go
David
ahead.
Schwartz.
Go ahead, Dave Schwartz.
Did
I hear you.
anyone?
I think
I got
hear
up for a minute, so you may have said something. We were concerned and are concerned about David Singer.
Yes.
Has anyone said anything at the meeting?
Yes, Dave Nydorf told us he had spoken with Elaine and he was not doing well. I think he's been on the ventilator for 12 or 13 days, but we had a little moment thinking about him and sending good vibes to him. So hopefully he will recover.
All right.
We're all rooting for him.
All right. Thank you.
Thank you. I saw somebody else. I think Mike Perloff. Did I see you again? Mike?
Yes.
Go ahead.
This worked out so well, I think we ought to consider doing it in another week or two.
We will. Thank you.
That's it.
Dick Nemiroff?
Mike, I want you to be very careful not to be overcome with kvelling.
Very nice. All right, gentlemen. Thank you all for coming out. I know that we're very thankful. We're very. What Bob Greenberg wants to say something. I have to find him though. Or it sounds like you're unmuted, or you unmuted yourself. Go ahead. No. Let me see if I can find Bob.
All right, I'm unmuted now.
Go ahead.
Can you, Richie, we ran out of locks on the far table.
Thanks, Bob.
Anytime.
Okay, gentlemen, please stay well, be safe. Please don't go visit the markets, unless you absolutely have to. I know they've taken a lot of precautions and so forth, but please just stay home. I know, this is very scary. We've never experienced anything like this. I don't think we can be too careful. If there's anything that the club can help anybody with, or knows somebody that needs some assistance, somehow I'm sure we can work it out. If it's not us, we'll do it through JFCS. Let me know. You have my email. Dave Schwartz, I think I saw you waving at me. Do you want to say something before we leave? Go ahead. You're unmuted.
No, I'm waving goodbye. Thank you very much.
Goodbye. All right, everybody,
Ed,
wave goodbye.
Ed, can I
have
say
a great day, as
Ed?
great as you can have. Please make it a good day.
Ed?
Thank you, everybody.
Ed, can I say
Yes.
something?
Yes, go ahead.
For those who are BJ's members, BJ's offers a home delivery, and if you enter the information, they will get back to you with a delivery date, so that you don't have to continue to go into the system and try to connect up.
Thanks, Bob. I didn't realize that they did that. Does anybody else want to give everybody a hint? I mean, I've seen all kinds of hints on, which market to go to, which one was, easy to shop, and it seems to vary from day to day. People said, Aldi was a great place to go, and then somebody else said, I went there and there was an hour wait in line. Same thing with Trader Joe's. So I think it's hit and miss, guys. I think you just have to get lucky or just keep trying. But if anybody wants to say something specific about, I see Lee Yasker. Lee, you want to, I'll unmute you. Go ahead.
Okay, thanks. I know that Whole Foods markets run a line letting people in, and they only let a few people in the store at one time. Relatively speaking, everyone going in has to have gloves and mask, and they clean the carts for each person ahead of time. And they seem to have an early shopping time for folks our age. So you're not surrounded by a bunch of younger folks.
This is Abe. I just got my delivery from my son. He said that actually he was waiting in the parking lot for 9 o'clock because before 9, so people below 65, so they didn't let him in. But Whole Foods and Ellsberg Circle is okay. He bought me 3 bags of food just now. That's why I walked out. But again, we can go there before 9, but if somebody younger, your kids are going, don't tell them to show up before 9 because they're not going to let them in.
Anyone else? Don?
Yeah, Mike, can you hear me?
I think
No, I can't hear you at all, Don.
Can you hear me?
No, can't hear a word you're saying.
Don, go ahead.
Go ahead.
Okay.
Yeah, go ahead.
Yeah, I just wanted to mention to Mike, if you could thank Kathy for giving Sarah her smarts. We know you had nothing to do with it.
I thought that's obvious.
She did a great job.
Mike, where does she work? She works in the Iceland in New York or Philadelphia?
In Philadelphia.
Okay.
All right, I'm gonna unmute Alan Finkelstein. Go ahead, Alan.
I have a question for Mike Perloff. Have you figured out a way that we can play Pinochle from our computers at home? Because I really miss it.
Yes, I won every hand.
Oh, nice guy.
All right, anyone else? Raise your hand or unmute yourself. You can unmute yourself if you look at the screen. There's a microphone with a line through it. Just click on it. I don't see any hands. I'll go through the array one more time.
I want to say that even Wegman also has from 7 in the morning to 8. Everybody can go in our age. Nobody else, young people, can go in.
Yeah, I forget who told me. Somebody I spoke with in the club told me that their personal shopper that was picking their order at Wegmans actually called them on the phone, and when they were out of something, they were showing them what the alternatives were and so forth. I thought that was great. I hadn't heard that before.
Ed, yeah,
Whether that's a Wegmans policy or if it was just this shopper that was doing it for whoever had placed the order, I don't know.
That's Ed. That's what happened to me with Wegmans. I've had 2 shoppers. They can't find something. They've texted me and actually shown me pictures of what the alternatives are. So
that sounds great.
Yeah.
Yeah. Bert? Go ahead, Bert.
Foods, however, they made substitutions without talking to me about it. And it was the things that I wanted, so I just cautioned. And also, there's a long wait in order to call in something to have it delivered. And shopping, it's over a week now.
Yeah, I think we've all experienced going on the web and trying to find a slot, and there just are no slots.
Right.
But I think you just got to roll with the punches.
Right.
If anybody wants something,
All right, gentlemen, I'm going to end the meeting, and please be safe. Do not take any chances.
You did a wonderful job.
Thank you. Thank you.
Yes. God bless you.
Thanks, everybody.
you know, if any of your friends
Take care.